You see a doctor holding what we call the puff air tonometer on a patient. Now this instrument, now doctor they measure the eye pressure because glaucoma na pressure disease. If the pressure dey high, damage go still dey go on for behind the eye, dey damage the optic nerve. And I tell you earlier, now this optic nerve, now be the wire where they carry information from the eye go the brain. Because you look with your eyes, but you see with your brain. So through this instrument, the doctor can check your eye pressure and take it down. Then the next test is called gonioscopy. So let's proceed to gonioscopy again. Gonioscopy. This is the test through which the doctor checks the angle, the anterior chamber angle. He checks the grading of the anterior chamber angle. If you look at the screen, you will see a patient. You will see the doctor holding the gonio lens on the eyes of a patient. This is the process through which the doctor checks the gradings of the anterior chamber angle to know if you have a shallow anterior chamber angle or a deep anterior chamber angle, and also to know if the angles are closed or open. This is where that word closed angle glaucoma comes, because in closed angle glaucoma, the anterior chamber angle is closed, which consequently will lead to increase in intraocular pressure in the eyes, and that will also cause more damage in the optic nerve. Then after this one, the doctor can also do what we call visual fade to know the level of damage, because glaucoma, wetin glaucoma they do, they say if you don't high, you can't damage the vision. So this is the the visual field of a glaucomic patient. Look at this one. The dark areas you are seeing, the dark shaded areas are the areas of damage, because what glaucoma does is that it destroys peripheral vision, narrow the eyes down to what we call tunnel vision. The person not going to see waiting there for the peripheral of the vision, because glaucoma and peripheral visual defect they always start from. You will the damage the vision from the periphery to the central unit. So this is the visual field test. So let's proceed to the risk factors of glaucoma. That is the next thing we are going into. Alright, now we are discussing about risk factors. What is risk factor? We call them predisposing factor. These are factors that will predispose you to having glaucoma. We will make you get this glaucoma. One, na age. If person don't come of age, like your age don't enter 50 years and above, you are predisposed, you are likely to develop glaucoma. So if you don't reach that kind of age, you suppose don't they go eye clinic before now. You suppose don't they do comprehensive eye examination for your body. Because now for only Africa, I go see person, he go day 60 years, he never go hospital. And he go take and they brag, say, they go hospital. I don't see many EPA. Maybe say they will tell me, say, doctor, I don't go to hospital, see my body sound. That is not a compliment. Because normally in the Western world, people go for body examination. Now, not even only eye, you go for general body examination at least every year or once every 6 months. So if you don't reach 50 years and above, you have to go for a comprehensive eye examination so that we can rule out glaucoma. Don't wait for what glaucoma day. Then the second one is race. If you are from the Chinese, or you are from Africa, or you are from East Asia, you are likely to develop glaucoma, especially the closed-angle glaucoma. Then the third one is myopia. If you have a very high level of myopia, like what is myopia? Myopia means short-sightedness. Let me break the word down, because that is why I'm the observer. I'm here to bring it down for you so that everybody will understand what it means. Myopia now when they see far, but they see waiting there near you. So if you get myopia, your eyes is predisposed, high level of myopia, your eyes is predisposed to having this glaucoma. Then the last one is retinal disease. If you have some retinal disease like retinal detachment, we call it rheumatogenic retinal detachment, or you have what we call retinitis pigmentosa. You understand? This one, some doctors go understand me, but now pigment are disease of the retina. If you have any disease of the retina, you are predisposed to having this glaucoma. So these are the things that will predispose you. Then we have another one we call congenital glaucoma. In this particular one, during the development of the child in the uterus, that is during embryology, most of the ocular structures are poorly developed, and this will lead to congenital glaucoma in children, and children are born with glaucoma. So glaucoma is a genetic disease and it runs in the family. If you have a parent who has glaucoma, then you stand 4% chance of having glaucoma. If you're a sibling to anybody that have glaucoma, you have 10% chances of developing this disease. That is why you have to go for a comprehensive eye examination. The aim and objective of this program is to create public health awareness so that everybody will be carried along. That is why I use pidgin to break it down to everybody. There is need for you to have gone to the clinic for examination so that we will rule out if you get glaucoma or not. Many people go, they wonder, say, this glaucoma, when they tell me, doctor, this glaucoma no get cure. I've seen many patients that when they come to the clinic and I'll tell them that glaucoma doesn't have cure, they feel so disappointed. But that is not our fault. That is why early prevention is better, because Oyibo people they talk and say prevention is better than cure. Now glaucoma make them they talk that one, because glaucoma causes an irreversible damage to the eyes, and that will lead to permanent blindness. That is why you need to go for examination. So glaucoma no really get cure. Now management to the manager. If now for primary open angle glaucoma, the doctor will prescribe some medication like beta blockers like timolol to reduce the pressure in the eyes. Then there are some other pressure reducing agents that can be given to you like Diamos. These are tablets that will be given to reduce the intraocular pressure. Okay, still in the management of glaucoma, your doctor can prescribe medications for you that will help to reduce the pressure. But if you already have glaucoma, it is good you go visit the clinic at least once in a month for follow-up. Because if you go clinic, the doctor will still do some tests to know the treatment. If they give you medication, make you take, no mean say the thing don't go. Glaucoma doesn't have permanent cure, just like diabetes mellitus or hypertension. You don't get permanent cure. Now you go clinic at least once in a month, so that the doctor can measure the pressure and also check your visual field to know the progress of the treatment. For people that have close angle glaucoma, because of it is a sight-threatening condition, there is a process what they call trabeculectomy, that is surgical opening of the anterior chamber angle, so that aqueous humor can flow. Trabeculectomy is a process where the doctor they do surgery to open up the angle so that aqueous humor can flow in close angle glaucoma. Do you understand? That is not permanent cure, but it's a kind of management for people that have close angle glaucoma. The normal tension glaucoma, you're also giving medication to control the pressure, and also you are also giving some supplements that will help you, some antioxidants, because glaucoma causes an irreversible damage in the optic nerve. And nerves, once they are damaged, they are irreversible. So what we'll do is just properly management. So please, you are advised to visit the clinic for proper screening so that we can rule out glaucoma from your eyes. The preventive measure of glaucoma is early detection. If we detect glaucoma very early, we can manage it, and you see with your eyes till the end of your life, to any number of years that you're going to stay alive. But if you present glaucoma case lately, that is where the doctor will, because most doctors are not magicians. You can't bring an end-stage glaucoma and expect the doctors to reverse the vision immediately, because glaucoma is a progressive disease. Now, disease where they chop the eye small, they come, because no waiting start one day and you don't get permanent cure. So the only thing you have to do is early detection. That is the only preventive measure that you can take to avoid your eyes from getting blind from glaucoma. So please, let's join hands to prevent this cause of blindness called glaucoma, because it is called the silent thief of sight, by going to the clinic for proper screening on your eye health and your general body health. Follow me on my Instagram, my TikTok, and my Facebook for more information. Our next topic, we're going to be discussing about cataract and diabetic retinopathy. Thank you very much for being with us. I still remember myself, Dr. Observer the Great, and I'll always be here to give you more information and educate you on your eye health and your general body health. Thank you very much for being with us.